When patients and families arrive for the OCD, anxiety, and depression adolescent residential program, the nurse meets with the family and the patient together first, and then they will get to meet the rest of the treatment team. So they'll meet their psychiatrist, their therapist, behavioral specialist, and our education therapist.
And then what they'll do is go out into the day room, meet everybody in the program. We do really focus on making them comfortable and meeting them where they're at rather than pushing them further than they're able to go.
The adolescents who come for treatment here have significant OCD or anxiety, but also struggle significantly with that mood or depression piece. And that's reflected in our programming. We offer behavioral activation. That's where adolescents get back into the routine or enjoyable activities they may have stopped doing because of depression. Our program also includes a dialectical behavior therapy component, and that helps adolescents regulate their emotions, cope effectively with challenging situations, and learn how to communicate better with other people.
The psychiatrist role, we are the ones who might prescribe a medicine if necessary, and that is an important part of our role. I also view my role in this to hopefully minimize the amount of medicines necessary.
On a typical day, after breakfast, they'll have an hour of cognitive behavioral therapy time. They'll also have an hour of school programming, during which they stay in the habit of completing schoolwork and work around anxiety related to schoolwork completion. In the afternoon, there's one more hour of cognitive behavioral therapy time and 1 hour of group dialectical behavioral therapy.
We're definitely building a foundation of skills. We do have them face their biggest fears. It's pretty much like the restructuring of your thinking.
We do have inpatient units if the event arises, that people really need that level of stabilization. Knowing that it's a resource downstairs reassures, I think, families and patients that they don't have to totally leave even the building if they need that. And we also have a whole primary care team who works alongside us in consultation with the nurse and myself, managing a lot of medical issues, which, especially with anxiety, that's very common. And it's very common to kind of try to figure out what is anxiety or what is headaches or stomach aches. And it helps to have that built-in medical team.
Our ultimate goal for adolescents in our care is to get back to their typical lives as soon as possible. And we do that in a number of ways. That's part of why we have school programming for all of our adolescents. And it's also part of why we're going out into the community as much as possible on therapeutic passes with family. We try to have weekly community outings with all of our adolescents. And we go out every now and then for exposures in the public, tackling social anxiety or contamination out in the real world.
One of the most memorable and impactful residence experiences I've had in my time as a recreational therapist here is I had a resident from a southern state who had never seen snow before, and they learned how to ski, and then they took their guardian skiing on a pass, and just the way that that impacts the family model, and just showing the residents that they can gain mastery, and them putting themselves in uncomfortable situations and being willing to try can be a great opportunity for the family itself to grow.
Families can expect 1 hour a week family sessions where they and their adolescents talk about their progress and next steps for treatment, and where families learn about what their kids are working on while they're here. And something that I like both the adolescents and their families to keep in mind is progress isn't just up, up, up. There are going to be days, even weeks, where you take a step backwards, and that's normal, and we're more concerned with the trends than any individual day.
A huge part of treatment is helping them recognize that their emotions aren't inherently good or bad, and that they serve a purpose, and that as they go through treatment, they are able to find out that they can regulate those emotions and do something with that. It's connecting the dots for them, and they find courage in each other. They're capable and empathetic of understanding the world around them.